Professor Sian Griffiths is the founding director of the Center for Global Health at the Chinese University of Hong Kong, and she joins us now from Oxford in the UK. Thanks so much for being with us. So with all the economic and even, psychological damage done, there is, of course, a rush to find a vaccine. But as we know, it's also led to this phenomenon of vaccine nationalism. What are your concerns about who will get first access and who won't?
Well, the developed nations have already put in orders for the vaccine. So if you take the UK as an example, we know that 4 million doses have been bought by the British government, and that they will 1 million will be made available this year, and that will enable 500,000 people to be vaccinated. So the governments that can afford to buy, can put in contracts, have done so. However, everyone recognizes that vaccine equity, as the WHO director was saying, is an absolutely fundamental value of the WHO and all members, and that we need to make sure that other countries can have access. And the coalition COVAX will make sure that there are billions of doses available to countries where they're not able to either purchase or manufacture vaccines. Now, it is a complicated world because this vaccine, the vaccine that was the Pfizer vaccine, requires very cold temperatures to be transmitted, and there's going to be issues about transport, about storage, as well as about administration and who are the priority groups who can receive the vaccine. So there are many logistic things that need to be considered. And as the other vaccines come online, the question will be, which are the most suitable vaccines? Some vaccines may not need to be stored at such cold temperature. There will still be a matter of how can they be distributed fairly and reach the most vulnerable populations,
right,
be it in poor countries or other countries.
I mean, who knows? There's even, a possibility that we could be a bit spoiled for choice. I mean, if all these vaccines prove effective, not all of them, but at least the leading three, let's say, that, people might have more than one option, and there could be enough distribution. But I need to ask you this. I mean, some argue part of the rush to find a vaccine has led to this now halted trial in Brazil. And I mean, there were huge protests there claiming that they were being used as guinea pigs. Now, that doesn't resonate well for vulnerable people around the world. So what are the risks of rushing?
Well, the fact that the trial has stopped, it's rather similar to the Oxford trial. You remember that the Oxford trial also stopped because there was an adverse event. That's part of the whole mechanism of assessing the safety of a vaccine. If there is an adverse event, the trial stops. It's assessed externally, judged to see whether or not the event is associated with the vaccine or with something else. If it's associated with the vaccine, then the whole investigation needs to take place as to why that is. In the Oxford trial, it turned out that the adverse event was not in somebody given the COVID vaccine. So it is actually that meant that that the trial could continue. So I think the Chinese trial should be seen within that light, and it should be seen as a reassurance that safety is being taken seriously.
Right. Unfortunately, though, and I hate having to bring this up, but it is an issue, there's a lot of misinformation out there, and you're unfortunately aware of a growing anti-vaccination movement, and some of the theories around it are absolutely absurd, but people are still, they're listening to them. So what worries you about that, especially if these vaccine trials are not done very carefully?
Well, I think we could be reassured that the vaccine trials are being done carefully. The phase 3 trial that's just announced, the 90% efficaciousness, is now going through the regulators, and regulators will check the data, check the safety record, check everything before they allow it to be distributed to the population. So people should be reassured by that. There really is, if we've been looking for a vaccine for a way out of this COVID pandemic, people need to trust the scientists, because they're doing this for the sake of the population, for the sake of the people. They're not doing it for any other reason. And it's just like the anti-vax messages about other immunizations, which mean that children suffer Old people, vulnerable people will suffer. Healthcare workers will suffer. There will be unnecessary deaths if we don't actually take up the opportunity of using this vaccine, making sure that as we do that, we monitor how long it's effective for, how much we may need to have an annual vaccine, what the program will be. We need to look at all of that. And people should feel reassured that the scientists in the world are not doing this for anything other than to control this pandemic. And that if we can control the pandemic, our economic situation will improve.
Indeed. Professor Sian Griffiths, thanks so much for being with us. We appreciate it.